Good morning, everyone. Welcome back. It is 6:44 this morning on 41 Action News Today. We are continuing to track the latest from the coronavirus pandemic.
Here are our latest numbers in this area. Right now, 1,056 confirmed cases in Kansas, including 25 more cases announced on Wednesday in Johnson County. They're up to 244 cases, the most in the state. In Missouri, 3,388 cases. There are a total of 424 cases in Kansas City and Jackson County. So with cases growing in our area, we still want to answer your questions about the virus because we know you have a lot of them.
Absolutely. Thank you to everyone who sent those in.
Yeah.
Keep sending them. We're going to keep talking to Dr. Hawkinson. We asked you on Twitter and Facebook, and we are joined live this morning with Dr. Dana Hawkinson at the University of Kansas Health System to get some of those answers for you. So, Doctor, one viewer asked us on our website, even if a patient tests positive for COVID-19, can they get reinfected weeks or months down the road? What do we know about what kind of immunity our body builds if we recover?
Yeah, we certainly know that you produce antibodies. You build an immune response to SARS-CoV-2. Our best evidence right now that we have is from the original SARS infection, where we know that you can have good amounts of neutralizing antibodies for up to 2 years, possibly even 3, but after 3 years, those antibodies go down. So we don't know the specific answer to that question. What we are hoping is that certainly in the near term, say 3 months, 6 months, a year, you will have built up enough antibodies. Should you come into contact with the virus again, you will have much more mild or no disease. And we still need to look at the long-term immunity from this infection.
Doctor, another viewer asked about testing that. Is there a way to test for antibodies for immunity later on? They're asking about an ETA, but is there a way on down the road to be able to test a person for immunity?
Yeah, absolutely. Today we can test for antibodies. The problem is there are a lot of labs that are creating these tests, and they really haven't been validated to say this is the infection that you've had. Some of these antibody tests can possibly react with other coronaviruses, the coronaviruses that cause the normal cough and cold. And so because so many different labs are coming out with their own tests, we really need to make sure that they're validated to say that if we detect antibodies, it's because it was truly against SARS-CoV-2 and not some other virus, including other common coronaviruses. So really it's a lab issue, and we're trying to make sure that if we use that test, it's going to give us the true results so that we do know if you have immunity.
That's interesting, and you forget that there are many kinds of coronavirus,
Right.
and we're talking about is a new one. One symptom of coronavirus, the one that we're talking about, is a dry cough. So one viewer wants to know, are Zyrtec and these other antihistamines not recommended to take because they dry up mucus, causing confusion if somebody just has allergies or is actually showing coronavirus symptoms?
No, I think if you're taking, for the most part, we've been consistent. If you're taking medications prescribed by your doctor or because you have certain things like allergies and you need Zyrtec to get through the day, especially coming into allergy season, continue to take it. It really shouldn't affect the cough much at all because a lot of infection type symptoms, even though they can be similar to allergy type symptoms, the medicines don't really work in the same way because the mechanism is different. So I think if you're having those symptoms, continue to take your allergy medications.
Good advice to have, especially this time of year when we have so many people that suffer from allergies, wondering whether or not they can take their medicine they're so used to taking. Dr. Hawkinson, as always, thank you for your time. Thank you for your knowledge this morning. We really appreciate it.